So we're going to talk about optic neuritis in a very specific circumstances, which is optic neuritis in pregnancy. And as you know, the most common cause of an acute unilateral optic neuropathy in a young person, but especially a young female, is optic neuritis. And the most common neurologic disorder associated with optic neuritis is multiple sclerosis. Of course, it could also be demyelinating antibody-mediated optic neuritis like MOG and NMO. You should go watch those videos. But in general, acute unilateral optic neuritis is usually MS in a young female or idiopathic. The key is in patients who are pregnant, their immune system is actually being suppressed on purpose, physiologically, because you're trying to avoid attacking your own baby. But what that means is females have to turn on and off their immune system relative to their pregnancy. And during the postpartum period, you might have a drop in your chance of MS or MS attacks, but then after the delivery, a rise in the number of attacks after the baby is born. And so when you have patients who have MS, they might have less events during their pregnancy, and then you have to be prepared for the postpartum development of an acute optic neuritis event. And so, in general, it's wise to counsel females about this. And because a lot of the drugs that are used for disease-modifying therapy for MS are not compatible with pregnancy, they have to have this discussion because they're often childbearing age females. And so, because they're a childbearing age female, probably it's best to go ahead and have this conversation in advance because you know that they're going to be thinking about it. So they have to be on adequate contraception for most of the disease-modifying therapies, which are potentially teratogenic in pregnancy. They should know that optic neuritis and MS even don't really affect the pregnancy outcomes or the fertility. And the main concern is getting an attack. If you were to get an attack, we can still give IV steroids. Of course, you have to ask OB about this. But in general, steroid is still able to be given, especially if it's towards the end of the pregnancy in a patient who has an optic neuritis and postpartum, even in a breastfeeding patient. Probably we should consider doing a preconception MRI in these patients to determine what their baseline is after they've stopped medicine, but it's a practice option because if the person's determined to have a child, regardless of what that MRI shows, then that's a decision for the patient and their neurologist to make. So you should know that optic neuritis can occur in pregnancy, but other optic neuropathies can occur in pregnancy. So we don't want to just assume that it's optic neuritis. It could be a compressive optic neuropathy. And the thing you're worried about in pregnancy and in the postpartum period is apoplexy, which can completely mimic optic neuritis because it causes loss of vision, an RAPD, a normal fundus. And so we have to do a visual field, and what you're looking for is either the junctional scotoma, a one-eye hemianopic field loss, or the junctional scotoma of Traquair, which is the monocular one, or loss of vision and a superior temporal field defect, or the classic bitemporal or homonymous hemianopsia. So we should really do a field on both eyes in every patient who has optic neuritis who's pregnant, even if it looks like it's only one eye, because you need to make sure it's not the mimic apoplexy. And both pituitary adenoma, meningioma, schwannoma, all these other tumors can grow during pregnancy. It could also be aneurysm because of the fluid shifts that are occurring. Aneurysm can increase in size and be diagnosed in pregnancy. So don't just jump straight to optic neuritis in a patient who is pregnant who has an optic neuropathy. We have to think about the differential diagnosis just like in a non-pregnant patient. And MRI scan probably can still be done in a pregnant patient, even though gadolinium is a category C. You really should be talking with the OBGYN about that. So the bottom line is optic neuritis in pregnancy, probably you should be thinking about that exactly the same as a non-pregnant patient, except it's probably going to happen in the postpartum period rather than during the pregnancy. Otherwise, same workup with